Okay, got another question here. I think this is from Aaron. I found out today that my 14-year-old cat has kidney disease, and I will be giving him sub-Q fluids at home 2 to 3 times a week, spiked with potassium, as well as a prescription diet. However, the vet couldn't tell me for certain what this mass is. She was unable to locate one of his kidneys and could not tell if this mass is the kidney itself, or if it's a cyst that has grown off of the kidney, or cancer, etc. One option she offered was to drain it, but she said there was a good chance that it would fill with fluid again, and it doesn't seem to be causing him any pain or issues beyond possibly being another reason why he pees so frequently. I'm just wondering, what are your thoughts regarding whether it'd be worth draining it? She has said there isn't really any medicine that will stop the kidney disease from happening at this point, but is having me give subcutaneous fluids with potassium added 2 to 3 times a week. Now, Aaron's provided some blood work, and in the blood work, we can see that there is some hypokalemia. There's low potassium going on. I watched your video and it was so helpful. What would you make of a large mass like this, and whether you would suggest draining it, even if he doesn't seem to be experiencing any discomfort at this time? He has gone from 13 to 7 pounds, and I think his most significant weight loss has been within the last 4 to 6 months. Not to complicate things further, but now I'm being told by others who've had cats with this that dry food can create more dehydration, and prescription diets, like they prescribed me, lack protein and nutrients to maintain his health. Would love to know your thoughts on that, but only what you're willing to share. Here's the thing, if I met your cat in person and I had your description of what he was doing, and then I saw the blood work, and then I had felt his abdomen and I felt an enlargement there, and then I took those x-rays and I saw that mass. And mass simply means there's something in the abdomen. Mass, it's a mass of something. We don't know what that is. Right off the bat, I know that it's in the retroperitoneal space, and it's enlarged. It's pushing down. You can see the colon flopping down. It's being displaced. So I have a displacement effect, something in the abdomen that's moving around in response to something else that's pushing it, occupying space. So if the diagnosis is a cyst, it's not exactly cut and dry if draining it helps or if draining it doesn't help. I wouldn't be surprised if there's some cats where it benefits and other cats where it doesn't. So should you drain that cyst? I think there's 3 elements to this. There's 3 people who need to be on the same page for that to be the right decision, or a decision to be considered. First of all, the first decision is your cat's. If your cat is amenable to working this way, if your cat doesn't mind being handled, if hospitalization and all those sorts of things work out okay for your cat, well then maybe your cat might say, okay, it's a reasonable thing to try. There's some cats where, they're like marshmallows. You can do a lot of things. For other cats, the journey itself, that pathway of therapy can be quite stressful to them. There's ways to manage that, but it's gonna, that's their part of the decision. Then there's your vet. Your vet might say, the last 10 renal cysts I've seen like this, X amount did okay with drainage, others it didn't really seem to help. So, they're gonna be kind of pitching some odds. Maybe the odds fall on the side of doing it. And then of course you've got that person, you've got that guardian in there, and your opinion counts as well. So I would say it's the sum of all 3. How does that come out? And then there's your decision. And I've seen cats come in with massive, massive kidney cysts, huge, and they actually came in for a different problem. You x-rayed them, you found it, and lo and behold, this cat was just doing its own thing. And, you didn't know about it. We didn't know about it. If you decide to do it, it's worthwhile to know, well, where does that go? What is the specific goal for that technique? Are we expecting a better feeling? Does my appetite go up? Do I feel any different? Two more things I wanted to address. Okay, so as you're working with your cat, you mentioned something in your question that was super important, and that was this. He has gone from 13 to 7 pounds, but I think the most significant weight loss was within the last 4 to 6 months. Okay. Weight loss for me is everything. Body weight for me is everything. Meaning that I will do whatever I need to do to either slow down the weight loss stabilize and prevent weight loss, or even try to pack more weight on them if they're inappropriately skinny, which a lot of cats are who have these problems. Let's talk about that word, CKD, or chronic kidney disease. It's an umbrella term, and what that means is that there's at least a dozen underlying reasons of why your kidneys can have what we call CKD. So CKD for one cat can mean something 100% completely different from another cat with CKD. The underlying thing of what those kidneys are doing, the cause can be different. And so what works for one cat, what affects progression for one cat can be different for another. And so with your cat with that renal cyst, beyond specific breeds that are prone to that, it does put you in a unique situation where certain things that are true for some cats aren't true for yours. What might be effective for your cat doesn't necessarily going to be effective for a different cat for something that we essentially call with the same name, CKD, right? So it's the one thing I want you to be aware of, the variability of what we call CKD. The actual underlying problems can be different. So let's briefly touch upon food. As a veterinarian on the internet, talking about food can be just like talking about religion or politics. It can be that contentious. So when we talk about food or anything, subcutaneous fluids, therapy, medication, whatever, there needs to be, for me, a specific goal. If I am making a change, if I'm presenting something new to a cat and a person together, and they've got to work through this change together, I'm asking them to go through this process. What is the goal? There needs to be a strong goal. If I'm asking you to do this, I expect to see this. By the way, we're talking about cats who are going through illness. My views can be different if I'm talking about healthy cats and we're talking about longevity. For a cat with an illness, this is what I think. Absolutely, you are going to be getting conflicting opinions, and that is 100% normal. It's the way of the cat. You will get conflicting opinions. Never will that not happen. And here's the thing about those conflicting opinions. In some circumstances, they can both be correct. This information about this type of food is correct. This information about this type of food, both the pros and cons, is also correct. So what do? This is what I do. It always comes down to a specific goal. If I'm using this food, what is my specific goal for my cat? For me, if my goal is stabilizing body weight in X amount of time, what that means is the food choices that I'm going to pick are far placed within palatability and caloric density, and less about macronutrients, the ratio of my protein to fat to carbs. It's not that it's a hard, fast line. It's just that, oh my goodness, there are specific characteristics about that food that play a number one goal, because if I don't reach that one goal, it's a wash. They don't tolerate malnutrition and starvation very well. I'm not saying your cat is starving, but what I am saying is with rapid weight loss, they can only compensate and not show the negative effects of that for a certain amount of time. A lot of cats they sit there, they compensate. They don't show anything until it's too late. That body weight has to stabilize, or at least the weight loss. Sometimes it's just about slowing down the rate of change. And so for me, I need specific actions for specific foods to get to that goal. And I'm less concerned about macronutrients in that particular pet in that particular phase of time. Food for me, it's very plastic. It flows through a therapeutic course. I have specific goals and needs and approaches depending on what that particular individual needs, what that relationship needs. How do you know what to feed your cat? How do you know if you're getting the right recommendation? Always ask, what is the goal? A food can accomplish many different things, but I'm expecting it to do a job for me. That food is working for us. It's working for your cat, it's working for you, it's working for me. And that food's got a job to do. When you're having a discussion with your vet, you can ask, what is the number one thing we want this food to do? If the answer is something vague where it's good for kidneys, for me, that's a little bit too vague. What is the specific goal that we're trying to achieve? That is what I want to know. Then when I flip around and I look to see what's inside of that food, I want to know if those ingredients and the calories presented and the potassium for your cat that's in there, will that help me get towards my cat's specific goal? If the answer is yes, maybe this is a good choice. Yeah, I'll get other opinions, but if the answer is no, or if there's better, well then I'm switching. I'm looking for something else. Good luck, let us know how things go, and I hope that helps.